Welcome, everyone, to the latest research on rape-related pregnancy by CDC. We are super excited you all are joining and listening in with us today. I am Taylor Teichman, project coordinator with the National Sexual Violence Resource Center, and this is part of the National Sexual Violence Resource Center's Research to Practice initiatives, where we bring together researchers, preventionists, and advocates to explore current topics of research and the ways we can be implementing and exploring that research within our everyday work with one another. And I am super excited to be talking about the latest research on rape-related pregnancy with Dr. Kathleen Basile, a senior scientist at the Division of Violence Prevention at the CDC. Dr. Basile serves as a senior scientist in the Office of the Associate Director for Science in the Division of Violence Prevention of the CDC's National Center for Injury Prevention and Control. She is responsible for providing leadership, planning, and guidance to division management and staff on scientific policy, training, and research priorities on violence prevention topics. The Division of Violence Prevention is the primary CDC organization tasked with surveillance, etiology, evaluation, and program dissemination and implementation across many violence topics, including intimate partner violence, sexual violence, child maltreatment, youth violence, suicide, and elder abuse. Dr. Basile is a Division of Violence Prevention subject matter expert for sexual violence definitions, research, evidence-based prevention strategies, and surveillance, and also has expertise in intimate partner violence definitions, research, and surveillance. So again, we are super excited to be talking with Dr. Basile this afternoon. Thank you so much for joining us, Dr. Basile. And we'll kind of dive right in and learn more about this really exciting research that you all have been doing at the CDC. So just wondering if you can share with us why you did embark on researching rape-related pregnancy.
And thanks again for inviting me. I'm really excited to share these research findings. So for this paper, there was not much information in the literature about the topic of rape-related pregnancy. And there had not been a nationally representative study like this done since the mid-1990s to our knowledge. And the National Intimate Partner Violence and Sexual Violence Survey, or what we call NSVRC, is one of the rare sources of nationally representative data on this topic. So we really wanted to provide a more current prevalence of rape-related pregnancy by using NSVRC data.
Thank you. Yeah, it's wild to think that it's been since the 90s that there's been some research. So it's super exciting that you all have dived in to take a look at this since it's been such a long time. Just curious, Dr. Basile, if you can explain a little bit more about how you approached researching this topic.
Sure. So NSVRC offered an opportunity to examine rape-related pregnancy, and the way the data were collected in NSVRC enabled us to say that the victim attributed the pregnancy to a vaginal rape victimization. So as I mentioned, this is the first study in over 20 years to offer a nationally representative prevalence estimate of rape-related pregnancy of U.S. women by any perpetrator. We're not just looking at intimate partners, but any perpetrator of rape. And also, it's the first national study, or it's the first national prevalence estimates by race and ethnicity. And that was another contribution we thought this paper added. We also examined the relationship of rape-related pregnancy to reproductive coercion by an intimate partner, which has only been done in clinical samples that we're aware of. What I mean by reproductive coercion, so we define that in NSVRC as behaviors that interfere with contraception use and pregnancy to maintain power and control in a relationship. So while there are many forms of reproductive coercion, NSVRC asks respondents two questions to get at reproductive coercion. One, whether they had a partner who tried to get them pregnant when they did not want to get pregnant, or who tried to stop them from using birth control. and 2, if they had a partner who refused to use a condom. So that was our approach to the study, and that's what we focused on. And we feel like these findings from the study add to the field's understanding of the relationship between sexual violence, intimate partner violence, and reproductive health of U.S. women.
Yeah, thank you so much for sharing. So I've noticed and I've heard you mention the NSVRC a few times now. So I'm just wondering if you can explain a little bit more about what exactly is NSVRC. Yeah, and if you can just kind of tell us a little bit more about it.
Sure. So again, NSVRC stands for the National Intimate Partner and Sexual Violence Survey. It's an ongoing nationally representative telephone survey. It collects data about sexual violence, stalking, and intimate partner violence, as well as immediate impacts of that violence and health conditions associated with those types of violence. So NSVRC uniquely provides both national and state level data about the prevalence and characteristics of those 3 types of violence: sexual violence, stalking, and intimate partner violence, and also the extent to which minors experience those types of violence. NSVRC collects data from all 50 states and the District of Columbia through a survey of English and Spanish speaking women and men, and it's adult women and men ages 18 and older, and those who are not institutionalized. So it's a telephone survey, as I mentioned, and the telephone survey is done by random digit dialing of both landlines and cell phones. So that's a little bit about NSVRC.
Great, thank you. That's super helpful, especially for folks who may not be as familiar with NSVRC. So, as part of this research that you all did, and through the approach that you all took, what were your key findings then?
Okay, so there's several key findings. So I'll start with one key finding is about 18 million women in the U.S. have experienced vaginal rape in their lifetime. That's an estimated number, 18 million women. An estimated 3 million women in the U.S. experienced rape-related pregnancy during their lifetime. Another finding is the prevalence of rape-related pregnancy was similar across racial and ethnic groups. And the groups that we looked at were Hispanic women, white non-Hispanic women, Black non-Hispanic women, and other non-Hispanic women. Another finding is that women who were raped by a current or former intimate partner were more likely to report rape-related pregnancy compared to those raped by other perpetrators like an acquaintance or a stranger. So those raped by an intimate partner, there were 26% who reported rape-related pregnancy compared to 5.2% raped by an acquaintance and 6.9 or almost 7% raped by a stranger. Mm. Another finding is of women who were raped by an intimate partner, about 30% experienced a form of reproductive coercion by the same intimate partner. Specifically, when we look at the 2 types of reproductive coercion we measured, 20% reported that their partner tried to get them pregnant when they did not want to or tried to stop them from using birth control, and 23% reported that their partner refused to use a condom. And then finally, another finding is that women raped by an intimate partner who reported rape-related pregnancy were significantly more likely to have experienced reproductive coercion compared to those women who were raped by an intimate partner but did not become pregnant.
Thank you for sharing. So I think knowing that this is the first research that's been done in over 20 years, and with some of those really huge key findings that you all found through this study, I think one thing that our viewers, our listeners would be curious to know is how can this research and these key findings really then begin to inform our prevention practices?
Mm-hmm. So I think there are a few ways that we can think about this work and how it might inform prevention practice. And I'll just give a couple of examples, and then I'll talk more broadly about prevention practice. For one, for this research, we think the research suggests that primary prevention efforts For example, efforts that help young men develop healthy, intimate relationships and a positive sense of masculinity, they may be useful in reducing rape and intimate partner violence, including reproductive coercion, in the first place. So from happening in the first place, primary prevention. And those efforts may also help in reducing the negative reproductive health outcomes that come from sexual and intimate partner violence. Additionally, the inclusion of services for sexual and reproductive health with sexual violence and intimate partner services can help ensure comprehensive care is available for women, including survivors of rape. I wanted to also share some general information with the listeners about how CDC thinks about prevention. CDC focuses on preventing violence before it starts and also working across sectors for a comprehensive approach to prevention. So CDC's violence prevention technical packages can be found on our website. You can just search at the CDC website for technical packages. And they detail the best available evidence for preventing rape and other types of sexual violence, as well as intimate partner violence. There's a technical package for each topic, sexual violence and intimate partner violence. These technical packages also contain approaches to help states and communities support survivors and lessen the short and long-term harms of violence. So that's just a little bit about prevention implications.
Thank you so much. So I think kind of as a lifting off point from our previous question, just wondering how can prevention practitioners also best communicate this data and these key findings and really these lessons learned to others?
Sure. I can offer some ideas or thoughts around that. So CDC creates data briefs. We also create infographics and other types of easily digestible materials to make the data come to life. You can find all of these on our CDC website. For this paper, you can find them by searching NSVS, NISVS, on our CDC website. For this study in particular about rape-related pregnancy, we did create a fact sheet to help communicate the data in a way that we thought would be easy to understand. CDC is very active also in social media. So we recently published a video, just to give you a few examples, we recently published a video showcasing how bystander intervention is being implemented in a community in Missoula, Montana, and that is called Make Your Move to Prevent Sexual Violence. You can search for this at our website. We also have a What is Sexual Violence video and a NSVS promotional video also under the video resources on our NSVS web pages. So when you get to CDC, if you type in NSVS, it should pop up our NSVS web pages and you can find all these resources there. We think these resources may be useful in general efforts to prevent sexual violence and to communicate information and data about sexual violence. We also do frequently do webinars to share the latest data and prevention strategies with our partners, and our main channel for these are through Prevent Connect, so www.preventconnect.org. In addition, there are some tips I'm going to share from this document that we put together called Continuing the Dialogue, Learning from the Past and Looking to the Future of Intimate Partner Violence and Sexual Violence. You can find that document on our website as well, and we'll provide the link later in this recording. But these tips may help communities and states in talking about prevention. So you can also find, like I said, you can find this on our website if you search for Continuing the Dialogue. Just a final note before I share those tips. Public awareness is often driven by current events and incidents of violence that we see publicized in the media. Sometimes they're not expected, so they may just happen, and it's kind of an opportunity. When possible and appropriate, you can bring prevention into conversations about violence, particularly when there's increased public awareness, maybe around, based on current events happening. So as I mentioned, the general tips to keep in mind when communicating data, I'll just share some of these. One idea is sharing examples of prevention work its progress and impact over time. In this way, you're telling a story of how prevention happens. So for instance, talking about a prevention strategy, as in a healthy relationships curriculum, for example, sharing information about actual skills that students learn, like communication, decision making, or learning about consent, and what changes to the school climate and reports of bullying resulted as a result of those strategies. So it's kind of like the idea is telling a story about prevention and how it works and how it happens. Another tip is showing the cost benefit or return on investment for prevention. And that's a really often can be a powerful message. If possible, determining these calculations at the state level or at the local level can be a message that resonates across audiences at those levels. However, the national estimates are effective as well, and we have some of those that we've published in terms of costs of violence. Another tip is using language that is understandable to the intended audience. That's really important. Sometimes it's overlooked. Using plain language and avoiding jargon is an important thing to remember. And then finally, being prepared and taking advantage of opportunities to bring prevention into the existing dialogue. Having materials and messages handy for prevention, for timely dissemination when an audience or a general public is paying attention to the issue. Like I said, if there's something that happens in the media that brings attention to an issue around violence, being prepared to take advantage and to use those opportunities to bring prevention to the forefront. That's it.
Yeah, thank you so much. I think those are very helpful and really tangible tips that folks can kind of take and run with. I so love the idea and the thoughts around using like those elements of storytelling as part of also using plain language and incorporating, those kinds of elements into current and existing issues that are happening within communities. I think that makes it very bite-sized and doable to be doing the work. So thank you so much for sharing those tips. They are very appreciative.
Sure.
So we also have here, so just for folks, if you happen to have any questions based on what you heard through conversation today, as you take a look through the report, if you have any questions, to please submit those to myself. We'll be compiling questions, and then based on questions that we get, we're hoping to then share responses through some upcoming blog posts. So I encourage you to send any questions you have my way to my email address, which you can see there on the screen, and is teichman@nsvrc.org. And then just to share here some of, again, those resources that Dr. Basile had shared earlier. We do have those resources here, and we will make sure that you all are able to access the links to those resources so that you can continue to dig deeper and dive into this exciting work and really be able to bring this work into your communities. So again, just want to thank Dr. Basile for joining us, for talking more about this exciting research in this report. We do also have, in partnership with the CDC, the NSVRC has crafted some talking points as well around the report. So those are listed within the resources as well. So again, if you have any questions, please feel free to email me. And Dr. Basile, I thank you so much for your time and for sharing more about this exciting research that you all have been a part of.
Thank you so much for the opportunity to share this. I really appreciate it and enjoyed this.
Thank you.